Hello, my name is Joseph Muller, and today I will be presenting on diabetes and cardiovascular disease and how it can influence COVID 19. A little background on diabetes. Diabetes has three different types: type 1, type 2, and gestational diabetes. Type 1 diabetes is when the pancreas either produces little or no insulin, and without insulin, sugar is unable to enter the cells. Therefore, type 1 patients must inject insulin into the body. Type 2 diabetes is a deficiency in how the body uses sugar. It is a chronic condition that circulates high amounts of sugar through the bloodstream, which can lead to numerous disorders. This type of diabetes is the most prevalent. Lastly is gestational diabetes. This form of diabetes can develop when a mother becomes pregnant. Unlike the other two types of diabetes, this one usually goes away after the mother gives birth. It is noted for type 2 diabetes there is a higher prevalence and incidence in ages 45 to 64. However, the highest prevalence and incidence is among those 65 and older. There are also some risk factors that can increase the chance of acquiring diabetes. Some of these include stress, being overweight or obese, having high blood pressure, smoking and tobacco use, diets that are high in fats, sugars, and carbs, as well as socioeconomic status, such as being in poverty, can affect the development of diabetes. Moving on to a background on cardiovascular disease. Cardiovascular disease is a disorder of the heart and blood vessels. This disease is the leading cause of death in the United States. However, it is a preventable disease. If cardiovascular disease is detected early enough, it is easy to manage. Some of the risk factors of cardiovascular disease include smoking, tobacco use, being overweight or obese, having high blood pressure, having high A1C levels that are induced from diets consisting of high fats, sugars, and carbs, as well as being inactive. Moving forward to tie this to COVID 19, a brief background should be noted. COVID 19 is a global pandemic that had started December 2019 and continues to the present. It is a variant of the SARS-CoV-2 virus, which is a highly contagious respiratory virus that spreads through droplets of a cough or sneeze. Some of the risk factors for COVID include being in close proximity to people that have already acquired the virus. Another risk factor is having diabetes, cardiovascular disease, chronic respiratory diseases, as well as many more underlying health conditions. To start to bring this together, diabetes is a risk factor for COVID. This is because diabetics tend to have a greater amount of inflammation throughout their body. When COVID is acquired in these patients, this already higher level of inflammation increases even more and targets the respiratory system. Another reason diabetics are at an increased risk is because of issues with blood circulation. Diabetics tend to have poor blood circulation to begin with, and with the addition of COVID 19, severe blood clotting becomes a major issue. To further tie this together, cardiovascular disease is a risk factor for COVID 19 as well. Underlying cardiovascular disease is a risk factor. However, COVID has been noted to cause acute cardiac injury, causing a great deal of inflammation, leading to the development of cardiovascular disease in patients that had not previously had it. Given its novelty, there is very limited information between cardiovascular disease and COVID. However, it has been noted that those with underlying cardiovascular disease and those that had developed cardiovascular disease due to COVID, they were all seen to have a worse outcome. The target audience chosen was diabetics among middle-aged Caucasian males in the United States with cardiovascular disease. This target population was chosen because it is the second highest risk for acquiring both cardiovascular disease as well as diabetes. The most at-risk population for both cardiovascular disease and diabetes was 65 and older. However, this group would most likely not want to implement any changes to modifiable factors such as diet, smoking status, and exercise, whereas middle-aged males might be more willing to implement these changes. This target audience was selected for more of a preventative approach rather than trying to change something or someone that is reluctant to change. Males were chosen for this target audience since it is the leading cause of death, as well as having a higher prevalence in males than in females. The United States-based population was chosen because the United States has one of the worst diets and eating habits in the world due to places like McDonald's and Burger King that serve foods that are high in preservatives, fats, and sodium, which are factors that can contribute to the development of both cardiovascular disease and diabetes. Some factors that could be modified to help prevent the chance of diabetes and cardiovascular disease would include smoking and tobacco use. Cessation of smoking would reduce the risk of cardiovascular disease by anywhere from 2 to 4 times. A blood pressure of 140/90 or above is considered high. This is a modifiable factor that can be brought to a more reasonable blood pressure through a well-balanced diet. A high A1C can be a result of a diet consisting of high fats, sugars, and carbohydrates. Both of these are modifiable factors that can be regulated through a more well-balanced diet. Lastly, a lack of education can also be a modifiable factor that can contribute to the development of diabetes. When having adequate education on diabetes and cardiovascular disease, the chance of acquiring these are reduced. Some opportunities that could help reduce the chance of acquiring diabetes include expanding the knowledge of the younger generation while they are in school and stress the importance of healthy diets and exercise. Also, educate the younger generation on diabetes and cardiovascular disease, using social media and television commercials to reach the target middle-aged male population that stress the importance of checkups as well as managing diabetes and cardiovascular disease would be a proficient method of communication. Also, getting sponsors from the American Heart Association and the American Diabetes Association for programs in local communities that advocate exercise and better eating habits for people with diabetes and cardiovascular disease could prove effective. The last opportunity to help this target audience would be to propose universal health care to local, state, and federal governments on behalf of this target population in hopes of supplying people with necessary medications and care. Even with all of these opportunities, there is also a great deal of complication. There is always a chance of lack of funding for any programs to be implemented. Another issue that could arise would be the lack of exercise and lack of willingness to choose a more well-balanced diet. One of the more difficult complications would be tobacco cessation. Lack of education is yet another complication of the development of diabetes. Lack of medical attention is another possible complication. People might not be able to afford to go see a doctor or pay for any necessary medications. Lastly, lack of governmental cooperation could halt the process of passing universal health care, which could ultimately supply the population with necessary medical attention needed in the United States. Some of the actions that could be implemented to help reduce the chances of diabetes would be to improve education on diabetes and cardiovascular disease in health classes in schools, advocate for healthier food choices in schools and at grocery stores, improve overall access to health care, and attempt to implement universal health care, hold more public events that address diabetes and cardiovascular disease to help spread the importance of prevention and treatment, as well as to reduce the medical costs of diabetic and cardiovascular disease patients since they usually tend to be significantly higher in cost. Management of a knowledgeable team with a strong background in diabetes and cardiovascular disease would be a key factor in implementing and carrying out any events hosted by the American Heart Association or the American Diabetes Association. Another key factor in managing a program of this magnitude would be a well-versed marketing team to get the message out appropriately and effectively to the target population. And the last key factor would be to have partners such as the American Heart Association and the American Diabetes Association. Finally, to wrap this up, there are some of the expectations of this would be to help to reduce the prevalence and incidence of diabetes and cardiovascular disease in middle-aged Caucasian males, increase prevalence of healthier eating habits, reduce the use of tobacco, and to promote an overall healthy lifestyle. That's all. Thanks for listening. Bye.